Thank you very much. Good morning, everyone, and Happy New Year. I think it's the first one I'm having this year. Bonne année à tout le monde. So I'm going to get going. I'm going to give you a bit of an update. I've collated a few slides from some recent presentations that I think will be relevant for everybody, and I'm going to start with a presentation right now. I'm just going to share my screen. Great. So just to let you know that, as you know, we're really undercounting the numbers because we're not testing everyone. As you know, the PCR tests now are limited to individuals who are in high-risk settings and so on. But even at that, we have seen a tremendous increase in our cases. We've never had so many active cases in our area. It's over 3,000 at this point. We've reached the 10,000 number mark. Despite all the high numbers, we have 25 that are hospitalized, and these, from what we can tell, are patients due to COVID. There are a higher number of patients who are positive for COVID, but these are actually hospitalized because of COVID. Same in the ICU, majority of which are not vaccinated. That number gets bigger in the ICU of unvaccinated. We've had several deaths. We had unfortunately, two 90-year-olds in the community that have recently died of COVID-related illness. One was vaccinated, one was not. We have 42 ongoing outbreaks at this point in time. Most of them are in long-term care and congregate settings. And again, initially they were more staff rather than residents, and now it's kind of equalizing. We're not getting the hospitalizations or the deaths that we've been seeing with previous waves. So I think the third dose has some protective factor. And as you'll see, there is some data to support that. And that's hence the reason we're going to be giving them a fourth dose. As a matter of fact, we already started giving fourth doses to our long-term care. This is just to give you an idea of where Ontario is vis-a-vis the rest of the world. And you could see that Omicron has literally taken over the world. These are mostly Omicron cases as of January 11th. And if you look at locally, we've had the distinction of having the highest number of measured cases in Ontario, actually, and that's going down. We can see that, and you can see here that among all the public health units, we are among the highest in the province. But again, we're getting trends of going downwards. And our percent positivity, which is another indicator, is actually going up. The provincial positivity is about 32%, actually 28%. Ours is about 31, 32. We're ranked behind Ottawa in terms of positivity, but there are areas that are higher. So for example, we're at 41% in Hawkesbury area. We're 36% in the Cornwall area. And so these are going to be important measures moving forward as we change the way we monitor the indicators of COVID. This is a presentation that I took from the Public Health Agency of Canada that was looking at, so give you a sort of an update of what we know now, like, what we know so far, but what we know now we've now had Omicron in our vocabulary over a month now. And so these are the type of things that we're seeing. We're seeing that the hospitalization death and death rate was lower as compared to Delta, and so we have different sort of age groups and where they are. So they are, as you compare. So we know that although Omicron spreads much more easily and is more vaccine resistant, it is less severe of an infection. Not to say that it doesn't hospitalize people, not to say that it doesn't cause significant illness in certain people. But if you compare it with those and others, and then if you're looking at the way that Omicron has behaved, what we're hoping is that it's going to follow the trajectory of South Africa, where you saw a very quick rise and a very quick decrease, and we're not far enough into the peaks in the other countries, but we're seeing sharp increases across the world. The risk of severe illness from Omicron is lower. We know that. We're not sure why. Is it because we have more vaccinations? Is it because this virus infects more the bronchi rather than the lungs? which I think is what's happening. We know that the original and Delta versions would go, you'd breathe it in, it would go down deep into the lungs, into the alveoli, which is the air sacs where the oxygen is exchanged, and will cause a lot of infection and inflammation, and that will block oxygenation. And so what we're seeing now is that instead of going down, it kind of infects more the bronchi and the bronchioles, the small bronchi, and causes more bronchitic infection. And we see, and you'll see a study that I'll show later on, that's why they need less oxygen in the hospital. And conversely, younger babies now are behaving like a bronchiolitis, where their bronchioles are infected and have required hospitalization. And so I think that, and that's one of the reasons I believe that it sort of sticks higher up in the respiratory system and it's more easily transmitted. I think that's one of the reasons. That's my theory. But again, low number of cases will still overwhelm the health system, and particularly if you have the higher number of unvaccinated, the higher number of admissions you're going to get. And that's why we're really worried about our healthcare system and trying to preserve it. Again, this is what I was talking about. It seems that most of the hospitalized patients, compared to the previous versions, require less care and require less oxygen, actually. And so again, this speaks to the less severe disease by this virus. So what we know is it spreads more easily, but it causes less severe disease, albeit it can cause severe disease in immunocompromised individuals, elderly, and particularly those who are not vaccinated. In Canada, what we're looking at in terms of deaths, again, you could see that even with a high explosive number of cases that we've had very little increase in deaths here as compared to previous waves. We had a huge death rate here, and then the second wave, and then we started vaccinating here. So you could see that, and this is all the breakthrough that we've been seeing here starting to come up again. But again, not to the level, hopefully we'll be able to plateau it, but not to the levels that we're seeing there. And again, it was, if you recall, it was disproportionate in these waves, where it was affecting more the elderly individuals, particularly those in congregate care settings like long-term care and retirement homes. What we do know as well is that what we suspected and what we feared is that the 2 doses of mRNA don't work very well to prevent infection against the Omicron. However, they do prevent hospitalization. And a third booster, we know, increases that prevention even more, increases your prevention of getting it, but also increases your rate of getting prevents hospitalization at a higher rate. Let's put it this way. So this is basically what we've seen in some studies. This was done in Ontario here, and we're looking at Omicron. Really, 2 doses does not really respond very well in terms of infection, but we do know that you can compare it. But if you boost it up, it does increase it, but not as much as with the Delta. So again, even a third dose, we know that this shows 34%. Some studies have shown 70-75% a month or 2 later, and so again, there is a difference. This is what we feared, that Omicron would be resistant. One of the things that I want to tell people is that I know that there will be, if required, a version of the mRNA vaccine for Omicron as well. But at this point, like I said, a third dose would be enough, because as you'll see here, it is quite effective. 2 doses already, we can see here, 2 doses already prevent hospitalization to a high degree of Omicron here a couple of weeks after, and it kind of weans down a couple of weeks later, 4 to 6 weeks later. And so that's why, again, a third dose will increase the efficacy. We know that the third dose of vaccination will increase the protection against getting symptomatic disease, and increase even more the protection against severe disease, hospitalization, and so on. So that's very important. And as I've said, we also know that a third dose booster starts to decrease in efficacy, particularly among the elderly, particularly among those in the long-term care settings. And we're seeing some breakthrough infections, albeit less severe than previous waves in the long-term care settings. But that's why we're actually in today. We were in yesterday as well, vaccinating our long-term care residents, dose number 4. So just to summarize, the transmissibility is much higher. It's actually almost 4 to 5 times more than Delta. It can spread and double quite quickly. We know that it appears to be less severe, but it can cause some severe infection in other individuals with underlying health issues. We also know that despite it being less severe, just the sheer numbers that it can infect, that a small percentage, even a small percentage gets admitted, it will overwhelm our hospital system, and it will overwhelm not only the number of beds and ICU beds, but also our staff. Because don't forget, a lot of people getting infected at the same time. They're bound to be healthcare worker or other healthcare or essential workers, which I'll talk a bit later. So we know that you can get reinfection with Omicron, because Omicron doesn't, once you get infected with Omicron, it doesn't give you lifelong protection. That's a hallmark of the coronavirus group in general. And it can happen in breakthrough infections can happen. But there's another study that I want to show you here. I think it's the next slide. But however, we know that the vaccine, again, is even 2 doses does not prevent 100%. It actually is barely 20-30% protective, but the 2 doses prevent hospitalization, but the booster is what we need to do. And in England, they noted that it was 88% effectiveness following a 3rd dose, and some studies have shown even higher against hospitalization. That's what we're trying to do right now. The whole goal now is not to contain. We can't contain it. It's out there. It's to actually manage and protect our vulnerable situations, which are our hospital ICUs, our long-term care, our vulnerable patients, and essential services as well, including non-health, including infrastructure, fire, police, and so on. Do you want to decrease the impact? And that's all the measures that we're doing are geared that way. One of the things that I wanted to talk about as well is that we talk about an unvaccinated individual, can spread it very easily. But if a boosted individual with just the 2 doses gets Omicron, they may be able to spread it, but not as much less so than that. So again, another form of protection, because we want to be able to decrease the spreading of infection, even from people that are vaccinated. And again, I want to stress that I know we're getting a lot of people who have breakthrough infections, but 90% of the population is vaccinated. So of course, there's many more people. But if you look at it as proportion, by far, this disease affects disproportionately unvaccinated individuals. Very clear. I know that the people out there may think that, well, most of the cases are vaccinated. Well, that's because 90% of the population is vaccinated, and Omicron does not respond to this vaccine for infection, although we prevent severe disease. That's a very important point. Bringing it down to vaccinations right now, we're continuing our program right now. Like I said, we're distributing 3rd doses. We're over 70% on the 70 plus. We really want to focus on the 60 plus population, because they're the ones that have the higher breakthrough complications. So we want to decrease the breakthrough complications. So we want to increase the protection. So we're continuing to do that. We're also continuing, of course, with our schools. I'm a bit disappointed. Still, our kids are at 44.7% vaccination rate, 1st dose. And so I'm hoping that we can increase that as we return back to school. And so we're continuing again to encourage people to get vaccinated, 1st, 2nd, or 3rd dose. Please, if you do, get it done. Thank you. That would be very important, and the community will thank you for that as well. Now, moving forward, again, a lot of changes have occurred. I alluded to them during my last press conference. There's going to be modified testing, obviously, limited to PCR testing, limited to high-risk settings, individuals. Our contact tracing will no longer occur among non-high-risk settings, including schools. We will not be doing contact tracing in schools. Rapid antigen tests are actually going to be reserved for settings where we will be using them to determine whether a person can go back to work despite being isolated. Again, for high-risk settings, essential workers, and so on. They're not available to the public at this point. We have a shortage. Obviously, if we had more, they'd be distributed more, but now we're going to be limiting them to them in that setting. Also want to stress that if for some reason somebody has a RAT and is positive with a rapid antigen test, we will consider you positive. Otherwise, we will base your diagnosis based on symptoms. If you have any one of the COVID symptoms and any two of the minor symptoms, you should isolate for 5 days and so on. As we also said, the isolation duration has changed for vaccinated individuals, and that'll help bringing back essential workers earlier. School reopening is going to happen on Monday. I know that today there will be a release from the science table, and I've seen the data. Can tell you that there are tremendous psychological effects, mental health effects on our children. Ontario has had, I think, 27 or 28 weeks of no school, and that has paid a toll because of the social isolation of these children, higher rates across the age range of mental health, including anxiety and depression. And so this is something that we have to offset with returning back to school and putting in as much as we can to make the schools as safe as possible, which I know they are. And so this is what why the government is going to be reopening the schools. The science table will be releasing that recommendation today, if not already. I think they're at 11. And so I have seen the studies, and I've seen Ontario-based studies looking at mental health symptoms and really honed into even children without underlying mental health issues have had significant rates of anxiety, all due to the social isolation, regardless if they were doing synchronous learning, which is live learning, or on-demand learning. It was detrimental to their mental health. And so that is something that we need to offset as quickly as possible and returning them to school. And that's why we've said schools should be the first to open and last to close. Moving forward, like I said, we're not going to be basing our numbers on, we'll be changing our website within the next week to reflect the new strategy, new approach that we've been taking. We're going to have the new indicators that we'll be sort of looking at to gauge where we are, obviously are going to be hospital and ICU numbers. Again, for cases that are there because of COVID, outbreak numbers, trends in all these, test positivity, trends in all these as well, absenteeism, both in school, both in workplaces. We'll be working with our municipalities to gauge whether or not what percentage of their essential workers, critical workers, electricity, fire, police, water, those type of things. So we'll do our best to be able to see if they're really struggling. Maybe we can bring a person back. We'll have a test to work strategy as well for them as well, because we need to protect those critical services that are not health related services, but still critical services for community and community infrastructure and functioning. Wastewater levels will also be another indicator that will give us ideas of trends and so on. So we we measure both in Cornwall and in Hawkesbury, so that'll give us an idea of where that'll be as well. So finally, just as a final thoughts here, we're going to be moving forward into vaccination. Really, we need to get the first, second, third dose predominantly for everybody, but particularly 60 plus. We want to be able to vaccinate our children and so on, to be able so they can go back to school. Won't be in time for school, but we want to get it done. We will be holding school clinics. We're holding clinics 7 days a week across our area. We are accepting walk-ins for 60 plus and walk-ins from our area for 5 to 11-year-olds as well. For that, we have worked with CHEO and others to have clinics accessible for educators and healthcare workers, education workers and childcare workers to go to the CHEO hospital as well, to CHEO, to do those clinics. And we're working with the school boards as well to facilitate vaccination for their employees as well. So what we're seeing right now is really a change. I've talked about it again, the pandemic to an endemic. Endemic means we're kind of living with it, where we will have, a multiple high level of community immunity, either temporarily through getting the infection or by third dose and fourth dose and so on. That's one. And we will have medications. I don't think I spoke to them about them last time, but this is something that's very positive moving forward. There will be some medications medications right now that antiviral medications that we can use, and I'm hoping Health Canada approves them shortly, where there are specific COVID antiviral medications where you would, let's say you were tested positive and you're an elderly individual, has underlying medical conditions and are at high risk for a breakthrough infection and high risk for getting hospitalized and having severe disease. If you take that pill right away, your chance of getting severe disease will be significantly reduced. So if you combine all of those things together, a better understanding of what's moving forward, I think that on the other side of this wave, which I hope will be sharp and down, we'll be able to kind of live with it. We'll have cases here, cases there, but not to the point where it will affect. Again, what we're trying to do is to protect our healthcare system and protect our vulnerable and our essential and critical workers. Those are the things that we're trying to protect. As long as we can protect those, we'll live with it. And that, I think, is going to be the narrative post this wave moving forward.
Thank you, Dr. Paul. Merci. Our first question comes from Matthew Kupfer, CBC Ottawa. Please go ahead.
Good morning.
Morning.
First, I just wanted to kind of put to you the situation with third doses. If you're noting any kind of maybe reluctance or delay, if distribution is still going at that clip where we used to see people struggling to sign up, and if they're, I guess, what you have to say to the people who may be slowing down their efforts to get a third dose. I guess, does the phenomenon exist, and what is the EOHU doing to address it?
Okay, so first of all, we do have supply right now. Pfizer was a bit low, but we have a lot of Moderna, so we are getting, our clinics are full, but we we are seeing a slowdown for third doses. What I would tell people is that the third dose is really a way for us to start opening up society again and to protecting yourselves and your loved ones from severe disease. So it's important to get vaccinated. We are, like I said, we are working with partners. We're looking at areas that are less vaccinated to incite them to get vaccinated, to inspire them to get vaccinated, to convince them to get vaccinated. And so we're doing our best to be able to get the message out that this time around, we're hoping that it'll be something that we can then really change the whole dynamic of the pandemic into the endemic. Albeit we may need vaccinations, fourth doses or boosters moving forward, but for the time being, this is our way out, and this is the way to be able to have a more normal life, essentially.
Sorry, I guess there's just like, have you actually? I'm sorry to just go back to that first question, if I could.
Yeah, I didn't really understand it, so clarify it for me.
Okay,
I'll do my best. Yeah.
So, has there been a slowing in turnout? Do you get the sense that the interest in boosters is stalling right now? Is that actually a phenomenon that you're seeing in your health unit?
No. No.
Okay.
Our clinics are all booked, and we've had to add more. So that's a sign. When we start seeing clinic spaces not booked, that's going to be when we will get that. That'll trigger us worrying about it. At this point, all of our clinics are fully booked, and we add more and they get booked right away. So, and I do know that there has been a bit of a decrease in other areas, but we haven't seen that yet in our area.
Okay. And if I could just ask a question on the schooling issue. You've mentioned kind of there's a bit of a change in strategy away from containment. The testing won't be as available in schools as it maybe was before. There's the change in guidance that's come from the ministry so far. I guess for parents and maybe even for teachers who are seeing this shift, it kind of feels like the training wheels are coming off.
Yeah, I could see that. I could tell you, first of all, that there will be specific testing and testing protocols for schools. That's separate. That will be done directly the schools with the Ministry of Education. So there will be some testing protocol that's going to be announced. It's just that they don't have enough RATs, rapid antigen tests at this point. And it also will include take-home PCRs. However, I can tell parents that at this point, we know that from past experience, several things. and that's data that's going to be presented today, I think, by the science table, if not already on their website. We know that the rate of hospitalization and severe disease extremely low in kids less than 5 years of age. We had minimal intra-school transmission over the last year. Most of the transmission occurred outside of the school, and we know that measures are going to be in place to be able to protect even more of the kids. And the other thing that I'm telling them, so I don't understand, there's a paradox here. I know parents are worried about going back to school, but only 44% of the kids are vaccinated. So that's another way we need to. That's another tool that we have that I think is being underutilized. And finally, what I like to say is that Ontario has had 27 or 28 weeks with virtual learning, among the highest in the world. And we have seen Ontario studies that have shown very, very worrisome trends of increasing mental health issues in children, including anxiety and depression, that is directly linked to the social isolation brought on by the school closures.
My colleagues from Radio-Canada would also be interested in that answer. If you could, si ça va aider, je vais essayer de redemander la question en français, mais les changements en ce qui va arriver avec cette ouverture des écoles, ça semble que beaucoup des précautions qui étaient là, qui pourraient rassurer les parents dans les dernières ouvertures d'école ne sont plus là. C'est quoi votre message aux parents qui s'inquiètent que peut-être leur enfant n'est pas encore vacciné et ça, c'est la situation où il n'y a pas les mêmes mesures?
OK. Premièrement, au niveau des parents, je comprends qu'ils sont inquiétés. Je peux vous dire que les protocoles qu'on a dans les écoles n'ont pas changé. On a tous les protocoles, on a des tranches, des couches de protocoles, dépistage, masque, distance, tout ça est en place, ventilation est en place, les professeurs sont vaccinés. Les enfants, malheureusement, sont à 44% vaccinés, donc on pourrait l'augmenter. Ça va augmenter à la protection. Mais je peux vous dire aussi qu'avant qu'on a fermé les écoles cette fois-ci, le taux de transmission dans les écoles était minimal si on fait la comparaison avec autrement dit, tous les cas dans les écoles, soit aux professeurs, soit aux employés, soit aux enfants, étaient contractés en dehors de l'école. Donc, à mon avis, les écoles sont parmi les places plus sécures actuellement, au niveau de toutes les précautions que nous avons en place. Et comme j'ai dit tantôt, c'est très important pour augmenter ces protections. Une autre couche que je pense est sous-utilisée à ce moment-là, c'est parce que les parents, à notre région, à peine, on a 44% des enfants vaccinés 5 à 11 ans. Une autre chose qui est rassurant, c'est que le COVID est très, très légère. On a les données. Ils vont présenter cet après-midi, je pense, ou même ce matin, avec le table de séance du Ontario, qu'on a peu de conséquences importantes au niveau de COVID, c'est légère chez les enfants. Donc, avec tout ça, je pense que les risques sont vraiment minimales. Il y a un risque à tout le monde, mais ils sont à mon avis, sont minimales. Mais il faut aussi comparer les effets nocifs qu'on a chez les enfants. Les études des études antérieures ont démontré que pendant les 27-28 semaines des écoles virtuelles en Ontario que mène le monde, je pense que surtout à travers du monde, les effets nocifs chez les enfants, de l'isolation sociale due à les fermetures des écoles est très importante, surtout l'angoisse et les dépressions. Donc, tous ces facteurs, à mon avis, sont pour ouvrir les écoles, soit qu'on a, ça pourrait être rassuré que on vaccine l'enfant, on a l'entourage vacciné, on a tous les autres couches de protection. Et en plus, ça va être très bon pour les enfants au niveau de leur état de santé mentale. Jenna, next.
Thank you, Dr. Paul. Merci. Bill Kingston, Cornwall News Group. Please go ahead.
Yes, good morning, Dr. Paul. Happy New Year.
Same to you, Bill.
Yes, I wanted to ask you about the booster doses. I know you've said that you're exclusively giving or almost giving Moderna for people that are 30 plus. From the Hamilton Health Sciences FAQ on booster doses, they note that Pfizer is a full third dose. Moderna is a half dose for the third dose. And you're also having the highest marked cases that you said in the province right now. Is there any correlation that the booster doses that you're giving now are not giving enough of an immune response?
No, first of all, it's too early to tell that we're just starting to increase the third dose rate. So I don't think we can have a cause effect. No, the reason that the second dose is lower is that studies have shown that at a lower dose, it's quite efficient. As a matter of fact, in the elderly, it's actually more efficient than Pfizer. And that's why we're actually giving Moderna selectively at a higher dose there. In the younger population, it's been shown that even the half dose, because it's a higher dose to begin with, is effective. The studies have shown that. So we're doing that based on the company's data and the recommendations that we've had from the ministry.
Okay.
But there's no correlation at this point.
Okay, perfect. Thank you. That's my only question.
Okay.
Next question, Philip Blanchard, Morrisburg Leader. Please go ahead.
Hi, Dr. Paul. Happy New Year.
Hi, Philip. Same to you.
So my first question, you were saying to the CDC about the importance of kids getting back to school because of how many weeks there have been of remote learning and so on. This current shutdown that's happened has closed off recreation programs, indoor hockey programs, and that kind of stuff. Those are I would say nearly as important as the academic side for keeping kids active and healthy and also for their mental health. January 26th is when this 3-week shutdown is supposed to end. Do you see that ending, and do you see a lot of people returning to the rinks and hockey programs and so on?
Yeah, well, look, first of all, I agree that, you need school and you need the extracurricular activities. That's why they're called extracurricular activities. You're outside of school, recreational. I think that right now they have nothing. And we can control, and we know that by documenting and looking at what's going on, we have control of what's going on in the schools in terms of the rate of transmissions, in terms of what's in place. It's less easy to monitor and to control in those other settings where we've had a lot of outbreaks and breakthroughs. So my choice would be everything in place, but at a risk-based level, yes, I would open the schools first. And then if we're able to, by January 26th, based on the indicators that I talked about, I do foresee recreational sports opening again, but I don't predict that it'll go like, okay, open up right away. It'll be progressive like we used to do in the past, no contact sports, 10 at a time and so on. So I'm hoping that'll happen as soon as possible. And as I said, Philip, I do believe that we're on our way to be able to open up, even more, but it'll be progressive. But I'm happy that the schools, because that's 5 days a week, Philip, and that's their socializing, that's their learning, and that's their mental health development, which is very important as well. So we prioritize that in a setting that we have more control over. And as we progress to opening up, when the wave sort of starts going down, of course I think that extracurricular activities are important. But given a choice and given the circumstance, I'm happy that we're starting school on Monday.
Okay, sticking with the schools for a second, 45% approximately 5 to 11-year-olds have received a first dose, and they're just starting to get the second doses. And I know you've got the second dose stuff scheduled for the end of the month, but there is going to be no more reporting that there was before, where you have the outbreaks and that. So parents are coming in blind, and whether they're vaccinated or not vaccinated, you're still bringing your kids into that. So how can parents feel more comfortable with putting their kids back in, especially the younger ones, when there is less reporting overall? How do you feel?
Well, first of all, the reporting, reporting or not doesn't prevent it. Omicron is there. So, you know, I think that what we'll be dealing with is looking at absenteeisms, looking at a low risk setting. I stress again that the classroom is a low risk setting, given all the precautions that are in place. Vaccinating kids will increase that as well. Obviously, vaccinating teachers, third dose will also increase that. But I think that what we've seen in the past, Philip, is that most of the cases were from outside. We rarely had outbreaks in schools. And if we did, it was one or two, period. It wasn't big outbreaks. There were some exceptional things, but overall, we did not have any outbreaks. Most of the transmission that our data has shown occurred outside of the school, not inside the school. So if you combine that with the need to return to school for mental health improvement, I think that parents could be confident to send their kids back to school because there are multiple layers of protection in place, and we're going to be addressing, by sending them back, addressing at least or removing some of those mental health effects, because I saw the studies, Philip. They're quite worrisome.
And lastly, the location of the clinics have been largely at your EOHU offices, and that, which is not, you know, geographically you have some issues there. Do you think that the location of the clinics right now has been hindering getting those third dose boosters?
No, I just want to correct you. With the exception of our Castleman office, all of our other clinics are off-site.
Okay, but they're still in generally the areas where your EOHU offices operate. Like there's one in Winchester, there's one in, you know, Alexandria, and you have offices in both. You have Cornwall, which has got the mall and so on. So they're still generally in those areas and not in other areas. Do you think the geography is playing a part with not getting third doses?
No, I don't think so. I don't think so. And like I said, we tried to find Morrisburg, as you know, but we needed the arena. The arena wasn't available. So we're doing as much as we can to get it into people. If we need to do a pop-up in a school, and we're also doing our schools for the kids, by the way, and their families in geographic areas as well, so outside of our region. So it's hard. It's 5,400 square kilometers that we have in our area. So we're trying to be as equitable as possible. And I realize it's not as easy as, you know, if you live downtown in Ottawa, it's, you know, you can just walk to it. I understand.
Right. And actually, there was one reader question I had. Somebody from the leader, if you don't mind, someone emailed the leader about this, and I thought it was a good question to ask. This person had is in their 30s. They'd had 2 rapid antigen tests that showed that they were positive, or showed a positive indication. So, and this is right around New Year's. So they did their isolation for so many days and so on. But they've only had 2 doses of vaccine. They want to get their booster, and they're not sure if they should get their booster because they've had a case, and if so, when should they get it to be effective?
Very good question, Philip. It's the 5th time somebody's asked me that. Actually, it's good. I'm glad you asked me now, so we can share that. Yes, right now, coronaviruses, which is the COVID part of the COVID family, those viruses are notorious in when they infect you, they do not induce lifelong immunity. In other words, you forget the virus, your immune system forgets the virus. And so we need to, even if you've got the infection, the vaccine will give you longer lasting and higher protection than just the infection itself. The timing is right now has changed. It used to be 30 days after your symptoms, but now it's after your isolation and when you're symptom free. So if you isolated for 5 or 10 days, whatever it is, and you're fine, you can get your booster, and you would need it. I would recommend it because, as I said, particularly the Omicron doesn't induce long-term immunity.
Thank you very much.
Thank you.
Next question, Louise Mignot, Cornwall Seeker. Please go ahead.
Hi, Dr. Paul. Happy New
Hi.
Year.
Thank you. Same to you.
I'm concerned about the lack of available testing and data gathering from the PCR and rat tests. Okay, you mentioned medications that are, will be available, hopefully fairly soon, and you also mentioned that they needed to be taken at the beginning of infection. How can this work without testing to confirm that you have COVID?
Well, that's a good question. Most of the testing is reserved to vulnerable situations, and most of the vulnerable situations are going to be tested. And if, let's say, a patient is admitted to hospital, goes to hospital, is sick, they will be tested. So we will be testing individuals, and the medications will be reserved for mostly those high-risk contexts, which we're testing anyway.
Okay.
Okay.
But that still doesn't answer. I mean, we still don't know if somebody is going to be vulnerable down the line.
No, we know that an elderly individual, an individual with underlying medical conditions, an individual living in congregate settings like a long-term care, retirement home, group home is more vulnerable, is a higher risk setting. So we do know that.
Yeah, but
nothing rules out. Listen, nothing rules out in the future that if somebody is suspected of having it, a physician can prescribe it. But at this point, we're trying to minimize the infections and the severity of infections of people ending up in hospital. That's what we're trying to do.
Okay.
Okay.
I have another question. You mentioned that you would be changing the EOHU website soon. Okay. Mm-hmm. So with your reporting, will you now include numbers of unvaccinated versus vaccinated in the hospital and in ICU?
Yes. Yes.
And what they represent in terms of percentages for the community?
Yeah.
Okay. And will you add in information about pre-existing illnesses and age to round out the context of
we are trying to gather all that. Yes, as a matter of fact, I met my EPI team yesterday, so we can gather all that information. And we have a spreadsheet where we'll have vaccination status, second, third dose, underlying conditions, and so on. Yeah.
Super. Thanks very much.
You're welcome.
Prochaine question, Frédéric Pépin, Radio-Canada. C'est à vous?
Oui, Dr Paul, comment allez-vous aujourd'hui?
Ça va bien, Frédéric.
OK, alors on vous a entendu parler des écoles, mais moi j'ai une petite précision, je vais vous entendre là-dessus. Oui, les parents sont inquiets pour les enfants, mais les enseignants, il y a des inquiétudes de ce côté-là pour ce qui est de la main-d'œuvre. Parce que si un enseignant attrape la COVID, il ne pourra pas rentrer travailler et ça peut avoir des impacts. Là. Alors, il y a un risque de ce côté-là que les écoles ne puissent pas subvenir et continuer d'enseigner. Quel est votre commentaire là-dessus?
Oui, Frédéric, pendant mon discours tantôt, j'ai parlé que la crainte que j'avais avec le taux d'infection dans la communauté, c'est que non seulement les personnes dans les hôpitaux, mais dans les autres services essentiels, et ça inclut les éducateurs aussi, les éducatrices. Donc oui, on va travailler. En effet, j'ai rencontré les 4 directeurs d'éducation hier, et on a parlé, on a dit, oui, on s'attend à ça et c'est ça qu'on va viser avec le taux d'absentéisme, comment vous allez faire l'opération de vos écoles. Et aussi, on va travailler avec les écoles pour voir comment on pourrait, disons que quelqu'un est isolé, comment est-ce que cette personne pourrait retourner à travailler en utilisant les tests rapides, etc. Donc, on a des protocoles qu'on a pour les hôpitaux, pour les services essentiels, et on peut les partager et les utiliser pour ce fin-là, pour prévenir la pénurie qui va forcer les fermetures d'écoles. Parce que là, ça va être rendu dans les décisions de fermer une école vont être plutôt opérationnelles et non à cause d'infection.
Oui, exactement. C'est pour ça que je posais la question.
Oui.
Merci. Pour ce qui est de la 4e dose, vous en avez parlé très tôt, là, même en décembre, vous l'aviez annoncé que ça s'en venait pour les populations vulnérables. Est-ce que, selon vous, toute la population éventuellement aura besoin d'une 4e dose?
Je pense que oui. Je pense que le 3e sûrement. Je pense que la 3e va être, le minime. Ça va être celle-là qui va être le passeport bientôt, mais pas. On n'est pas là encore, mais je pense qu'on aurait besoin d'une 4e dose. Je sais que Pfizer et Moderna ont déjà une 4e dose avec Omicron dedans. Donc, ça pourrait être un booster, si vous voulez. Et je n'exclus pas, Frédéric, qu'on aurait besoin d'avoir un vaccin à chaque année comme l'influenza. Donc, on n'est pas sûr encore, on est en train de voir comment ça va se déclarer, mais ça ne se prendra pas qu'on aurait besoin d'une 4e dose. Et la 4e dose pourrait avoir l'Omicron dedans aussi.
Intéressant. Et une dernière question, si je peux me permettre, Dr Paul.
Oui.
Au Québec, on l'a vu, vous l'avez sûrement entendu parler, une taxation, une taxe pour les non-vaccinés. Pas juste pour quand ils vont à l'hôpital,
Je comprends, je comprends.
Est-ce qu'on a besoin de ça en Ontario?
Non, non, je ne suis pas d'accord avec cette approche. Je pense qu'on pourrait faire des autres choses, des autres mesures en place, comme par exemple de changer le passeport à 3 doses au lieu de 2 doses et d'augmenter les places qui ont besoin. À mon avis, tous les commerces devront avoir le passeport, sauf les services essentiels, les épiceries, hôpitaux, pharmacies. Donc, je pense moi, j'aimerais faire ça au lieu de taxer le monde. Non.
Merci, Dr. Paul. Merci beaucoup.
Pas de problème.
Those joining by phone have questions, press star 6 to unmute. Ceux qui se joignent par téléphone ont-ils des questions? Appuyez les touches étoile 6 pour désactiver le mode silencieux. Those are all the questions for today, Dr. Paul.
Thank you. Bye-bye, everyone.